Okay, hi, this is Bill. Lecture burst for chapters 33 through 35. Um, and it starts out with abuse in the family, child maltreatment. Family stressors can um, add to how a family handles these stressors, may lead to child maltreatment or abuse. Poor parenting skills may lead to child abuse if the parent has unrealistic expectations of the child or dysfunctional coping skills. Physical punishment can be classified as abuse if it leaves marks, causes injury, or threatens the child's physical or emotional well being. Those are things that you have to look for. Nurses are mandatory reporters. They have to report any suspected child abuse. The types of child abuse in the family, there is physical child maltreatment accounts for an estimated 700,000 to 1.25 million episodes of abuse annually. Physical abuse is the actual causing of injury on the body of the child, usually because of inexperienced caregiver, along with additional stressors in the family. A child may be emotionally abused, verbally or by emotional unavailability of the family caregiver. Poor nurturing threats involve leaving the child or role reversal in which the child must take on the role of the parent or is blamed for the parent's problems. The child neglect. Neglect is failure to provide adequate hygiene, health care, nutrition, love, nurturing, and supervision. And then there's sexual abuse. Can be incest, sexual contact, or sexual assault, and occurs in all social, economic, racial, religious, and ethnic groups. Substance abuse, job loss, and poverty are often contributing factors. Shaken baby syndrome is part of the physical abuse. Um, Infants who are roughly shaken can sustain retinal, subarachnoid, or subdural hemorrhages in the brain, as well as a high level cervical spine injury. Symptoms um, include extreme fussiness or irritability, difficulty staying awake, breathing problems, poor eating, vomiting, pale or bluish skin, seizures, paralysis, coma. In severe cases, child may be completely unconscious. The following things make parents or caregivers more likely to forcefully shake a baby and cause shaken baby syndrome: unrealistic expectations of babies, young or single parenthood, stress, domestic violence, alcohol or substance abuse, or any of those combinations, um, depression, instability in the family situation, a history of mistreatment as a child themselves. Mm, complications of a shaken baby. Survivors of shaken baby syndrome may require lifelong medical care for conditions such as partial or total blindness, developmental delays, learning problems, behavior issues, intellectual disabilities, seizure disorder, cerebral palsy. So it's not a good thing. Munchausen syndrome by proxy. Munchausen syndrome by proxy occurs when one person fabricates or induces illness in another to get attention. Um, New name for an old problem: fictitious disorders by proxy, child abuse, Munchausen's causes, No one is sure of what causes Munchausen syndrome by proxy. Sometimes the person was abused as a child or has Munchausen syndrome, fake illness for themselves. What are signs in a mother? Most people with this problem are mothers with small children. Some are adults, children taking care of an older parent. The mother often works in healthcare and knows a lot about medical care. She can describe the child syndrome symptoms in great medical detail. She likes to be very involved with the healthcare team and is liked by the staff for the care she gives her child. These mothers are very involved with their children. They seem to be devoted to the child. This makes it harder for healthcare professionals to see the diagnosis of Munchausen by proxy. Domestic violence in a family. In cases of domestic violence, the child may have witnessed, heard, or seen evidence of the violence. The child may be injured or have symptoms such as inability to sleep, bedwetting, temper tantrums, withdrawal, and feelings of guilt. He or she may be have academic problems, frequent absences, behavior issues, or isolate him or herself from others. The older child may use drugs or alcohol, commit crimes, or attempt to commit suicide. These children may become victims of or perpetrators of domestic violence as adults. Nursing process for the child who is abused. Nursing care goal for the child who has been abused. Focus on caring for any injuries. Nursing care that promotes parenting skills and coping benefits the child as well. Nursing diagnosis. Fear by the child related to the history of abuse or fear of abuse from others, impaired parenting related to situational stressors or poor coping skills. Anxiety is one. Disabled family coping related to unrealistic expectations of the child by the family caregiver. Ineffective coping by the non-abusive parent related to fear of violence from abusive parent or feelings of powerfulness. Bullying is also a form of child abuse. The child being bullied may be a victim of physical, verbal, psychological, or cyber abuse. Often the victim is perceived as somehow being different from the others. They're thus weaker. Symptoms may be physical or less obvious, such as anxiety, changes in mood. Support from trusted adults may help the child develop self-confidence and be more able to cope with the bullying situation. Okay. What is substance abuse? Substance abuse, 10% of households have substance abuse problems. When you add drugs to this, it goes up immensely. Alcohol and drugs are the main culprits in our society. The effects on children, child is guilt, anxiety, confusion, anger, depression, and addictive behavior themselves. Some of the other behaviors that may be seen and may alert the nurse to the fact that there may be a problem. The loner child, the child who is failing in school, the child who with frequent minor physical complaints, child who steals or commits acts of violence, the aggressive child, the child that has a drug or alcohol issue themselves. Okay. Now we're going to go over to death and dying of a child. There are 5 stages of death and dying. Elizabeth Kubler-Ross was the expert. She just died recently. Um, Denial or isolation. It is a normal reaction to rationalize overwhelming emotion. It is a defense mechanism that buffers the immediate shock of the loss. We block out the words and hide from the facts. 2 is anger. Anger may be aimed at inanimate objects, complete strangers, friends, or family. Anger may be directed at our dying or deceased loved one. In that, rationally, we know that the person is not to be blamed. Emotionally, however, we may resent the person for causing us pain or leaving us. 3 is bargaining. Secretly, we may make a deal with God or a higher power in an attempt to postpone the inevitable. This is a weaker line of defense to protect us from the painful reality. 4 is depression. We worry about the cost of burial. We worry that in our grief we have spent less time with others and that depend on us. This phase may be eased by simple clarification and reassurance. And then 5 is acceptance. It is not necessarily a mark of bravery to resist the inevitable and to deny ourselves the opportunity to make our peace. This phase is marked by withdrawal and calm. This is not a period of happiness and must be distinguished from depression. Stages of development of death and dying for an infant and toddler. Birth to 3 years, have little or no understanding of the concept of death. Egocentric thinking prevents toddler from understanding death. Mirror the parental emotion, anger, depression, sadness, anxiety. Reacts to the response to the changes brought on by being in the hospital. Preschoolers to children to 3 to 6 years of age. Egocentric thinking, along with magical thinking, allows for the belief that thoughts can cause the events such as death. School-age children 6 to 12 starts to respond to logical or fractional explanations, begins to have an adult concept of death, which generally applies to 9 to 12-year-olds. Experience fear of the disease process, death process, and the unknown. Adolescence is 12 to 20 years of age, can have adult-like concepts of death. Can have difficulty accepting death because they are discovering who they are, establishing an identity, and dealing with issues of puberty. Rely more on peers than the influence of their parents, which can result in the reality of a serious illness causing adolescents to feel isolated, can experience guilt and shame. So it's hard for family members also to deal with this. Factors influencing loss and grief and coping ability. Interpersonal relationships. Death of a child is a tragic reality for thousands of children and their families each year. Cancer, chronic illness, and accidents are all causes of death of a child, with accidents being the number one cause of death of a child for children from 1 to 14, and cancer is the number one cause of fatal disease. Okay, now we're going on to a little bit happier thing. See, the nervous system. The nervous system is a major communication center of the body. It develops in the third to fourth week of gestation, the central nervous system. Most neurological disabilities in childhood result from congenital malformation, brain injury, or infection. The 12th cranial nerve, there's 12 cranial nerves, are from the brain and for the most part control sensory functions, i.e. hearing, balance, facial movement, speech, eye movement. So that's where those are. The cranial nerves, as they're listed, is olfactory, optic, ocular, motor, trochlear, trigeminal, abducens, facial, acoustic, glossal, pharyngeal, vagus, spinal, accessory, and hypoglossal. When I was learning these, it was on old Olympus, towering tops, a Finn and German viewed some hops. Easy way to remember what they start with. All cranial nerves deal with mainly the head and the sensory of the head, except for one, and that is the vagus nerve, and that helps with your breathing and innervates your diaphragm so that you can breathe and do other things with your diaphragm. Here's a nice picture of what they all do and what they do, whether they're sensory, motor, or both. So look at that and see what you're doing. Okay. Children with neurological disorders, sensory or motor function of a child is much different than that of an adult. Sensory organs, ears, eyes, and brain, the master neurological organ. Ears contains the receptors of the 8th cranial acoustic nerve. 2 main functions, hearing and balance. 3 divisions, you have the external, middle, and internal ear. Newborn tympanic membrane, almost horizontal, more vascular, inconsistent light reflex. Eustachian tube is shorter and straighter than in an adult. That is what leads to ear infections. Function of the eustachian tubes are ventilation, protection, and drainage. This is a picture of the ear. The ear alignment is observed. Top of the ear should cross imaginary line between drawn from the calcaneus of the eye to the occiput. Low set ears may be associated with kidney disease. Acute otitis media. Pathophysiology, inflammation of the middle ear, structurally lined by mucous membranes. The mastoid sinus, middle ear, and eustachian tubes protects the middle ear, provides drainage, and equalizes air pressure. Otitis external is an acute infection of the external canal, often referred to as swimmer's ear. It's pain and tenderness on manipulation of the pinna or targus. Signs: tympanic membrane is normal. Rule out the presence of a foreign body, cellulitis, diabetes mellitus, or herpes zoster. Treatment: irrigation and topical antibiotics or antivirals. Otitis media occurs most often after upper respiratory infection caused by various microorganisms such as Streptococcus pneumoniae and Haemophilus influenza. Infants are more prone because of the ear anatomy. Infants' humoral defense mechanisms are also immature. The eye begins to develop at 4-week-old embryo. Newborn sight is not mature. They can't see very well. Shape of the eye is less spherical in a newborn. Tears are not present until 1 to 3 months of age. Depth perception does not begin to develop until about 9 months of age. A visual acuity test, ability of an infant to fixate and focus on an object, can be demonstrated by 6 weeks of age. The object should not emit a sound. Testing should begin at 2 to 3 years of age. Dyslexia is a reading disorder that involves a defect in the cortex of the brain. Some of the problems can be helped with glasses, but most of the time is taken training the brain to read a different way. Some famous people that have had dyslexia is Whoopi Goldberg, Will Smith, Bill Gates, Tom Cruise, and Albert Einstein. So just because you have dyslexia, that doesn't mean you're not smart. Okay, picture of the eye. There, showing all the layers, and go from there. Okay, amblyopia is lazy eye, reduction in the loss of vision that usually occurs in child who strongly favors one eye. When abnormal binocular interaction occurs in strabismus, the process depends on how long the eye has been affected and on the age of the child when treatment begins. It occurs as a result of the sensory deprivation of the affected eye. Children are at risk for developing this problem until visual stability occurs, usually around 9 years of age. Treatment: glasses, opaque contact lenses, or patching the good eye, not the bad eye, but the good eye. That makes the bad eye work harder and corrects the issue a little bit more forcefully. Okay. Picture of the amblyopia. Okay, strabismus, also known as cross-eyed. A child is not able to detect both eyes in the same direction. Lack of coordination between the eye muscle that directs movement of the eyes. When coordination does not occur, the brain will disable one eye to provide a clear image. There's several types. There's non-paralytic and paralytic, also called squint eye. Symptoms of strabismus include the following: eye squinting or furrowing to focus, missing objects that are reached for, covering one eye to see, tilting of the head to see, dizziness or headaches. Treatment of non-paralytic: if found in infancy, parent is instructed to patch the unaffected eye because it may improve through use. Glasses and eye exercises usually correct the problem. Surgery if none of the above work. There is different pictures of strabismus and what they can look like, so get to know it. Okay, Reye's syndrome, acute non-inflammatory process of encephalitis and hepatopathy that follows a viral infection in a child. May be a relationship with the use of aspirin during a viral flu or illness, i.e. chickenpox. Some studies show that a genetic metabolic defect triggers Reye's syndrome when the stress of viral illness produces vomiting and hypoglycemia. For this reason, aspirin products are not to be used on pediatric population. Manifestations are from the inflammation of the liver cells, and that causes an increase in the ammonia levels of the body, which causes an increase in intracranial pressure, and ICP Ammonia accumulates in the blood due to the liver involvement. Toxic levels cause cerebral manifestations such as altered level of consciousness, behavioral changes, seizure, coma in children, effortless vomiting, and altered behavior or altered level of consciousness after a viral illness is characteristic of Reye's syndrome. Treatment, if early, can result in complete recovery. Goals are reducing the ICP, the intracranial pressure, maintaining a patent airway, cerebral oxygenation, fluid and electrolyte balance, observe for signs of bleeding due to liver dysfunction. Seizure disorders. Most commonly observed neurological dysfunction in children. Etiology varies. They are sudden, intermittent episodes of altered level of consciousness that last seconds to minutes and may include involuntary tonic and clonic movement. Causes for seizure activities in children. Epilepsy, congenital abnormality, birth injury, infection, trauma, degenerative disease, vascular disorders. Toxic effects, anesthesia, drugs, and poisoning. Extracranial is a fever, heart disease, metabolic disorders, hypocalcemia and hypoglycemia, and dehydration and malnutrition. Types of seizures. There's a generalized seizure, onset without warning. Tonic phase is 10 to 30 seconds. Clonic phase is 30 to 50 seconds. And then postictal state is about 30 minutes. Tonic phase, eyes roll upward, loss of consciousness. Tonic contractures of the entire body. Clonic, violent jerking movement of the body, can have foaming of the mouth, incontinent of urine or feces. Postictal remains semi-conscious but arousable, confused for several hours, headache, vomiting, sleeps for several hours, no recollection of the seizure. There's absent seizures, which is previously known as petit mal or lapses, onset between the ages of 5 and 8 years old and ceases by the teenage years. Loss of consciousness for about 5 to 10 seconds, minimal change in level of consciousness. There's the myoclonic seizure, which is a variety of seizure episodes, brief contraction of muscle to muscle or muscle group behavior, lip smacking, twitching of the eye or face, or slight hand movement, no postictal drowsiness. Then there's the atonic or akinetic seizure, onset between 2 and 5 years of age. Muscle tone is lost for a few seconds. Loss of muscle tone results in falls. Types of seizures continue. Then there's a partial or focal local, simple partial with motor manifestations. During the seizure, protect the client from injury. Turn them on the side. Place a pillow or blanket under their head. Do not try to restrain the child. Anti-epileptic drugs, AEDs, diazepam, phenytoin, carbamazepine, valproic acid. There's several of them. We'll start out with one or in low dose and then adjust up to control seizure. Second drug may be added if not controlled by the first one. Okay. Epilepsy is a disorder manifested by a variety of symptoms complexes. It is characterized by recurrent proximal sudden attacks of unconsciousness or impaired consciousness. May have contractures, tonic movement, and relaxation, clonic movement of muscle tissue. It is a disorder of the central nervous system in which the nerve cells and neurons fire in abnormal ways. There is generalized seizures, involves loss of consciousness. What they used to call grand mal is what most people think of as a seizure. Petit mal or absent seizure is a temporary loss of awareness. Partial seizure accounts for 40% of all seizures. May be seen as a loss of awareness with slight muscle movement, like a tick. They just sort of move. Phases of a seizure, there's the aura, is a subjective sensation. Could be a smell, any of your five senses. Smell, a taste, a touch, a visual disturbance. The tonic-clonic is a seizure activity, and then the postictal is the lethargy, a short period of sleep after the seizure has happened. Then there's cerebral palsy, CP. A group of motor disorders caused by dysfunction of various motor centers in the brain and often related to antenatal or developmental factors. Can be precipitated by many factors such as birth injuries, congenital abnormalities, neonatal anoxia, prematurity, subdural hemorrhage, and prenatal infection. Manifestations vary with each child, may range from mild to severe. Mental retardation sometimes is seen. Suspected during infancy if there are feeding problems, convulsions not associated with high fever. Treatment, they have come up with treatments with botulism toxins, has been used to manage spasticity problems. Levodopa has helped to control some of the anthoid problems. Specific treatments is highly individualized. Good skin care is essential. All precautions are taken to prevent contractures. Braces are often used. So this is a form that shows what each individual one involves and what they are seen as. Okay, head injuries, major cause of death in a child under the age of 1. A concussion is a temporary disturbance of the brain that is usually followed by a period of unconsciousness. A child's response to the head injury may differ from that of an adult. The Glasgow Coma Scale will tell you if the person will recover from whatever insult they have experienced. The highest possible score is 15. The lowest is 3. Some of the things that you are looking for are the eyes open spontaneously to sound or pain or never. Motor responses, obeys commands, localizes to pain, normal, so on and so forth. Verbal responses. Look up the Glasgow Coma Scale and see what it does for you, okay? All right, posturing. Decerebral posturing. We're almost done here, folks. Decerebral posturing is a abnormal body posture that involves the arms and legs being held straight out, the toes being pointed downward, and the head and neck being arched backwards. So that's the top one there. Then you have decorticate. Decorticate posturing is an abnormal posturing that involves rigidity, flexion of the arms, clenching of the fists, and extending the legs held out straight. The arms are bent inward toward the body, with the wrists and fingers bent and held on the chest. This type of posturing is a sign of severe damage to the brain. It requires immediate medical attention. Okay, that's where I would rather be than here. But I think everybody would rather be there than here. Okay, be safe. Take care. And I'll see you when I see you. Okay? Bye.